Let me start by introducing myself. I'm Tiffany Tripathi, the chair of WISH. With me are Whitney and Daryl from the Foundations Department, who will be our Q&A moderators and helping with some technical detail of the presentation. So when we heard Laura Hennum was going to be giving a med talk for Good Sam, we thought this was a great opportunity for WISH to sponsor her presentation, and we're excited to announce that she's a new WISH member herself. So you might be asking yourself, what is WISH? So WISH stands for Women Investing in Samaritan Health, and it is a branch under the Good Samaritan Hospital Foundation. WISH was founded in 2004 and is open to women and men interested in supporting the health needs of women and children in the Corvallis area, both their physical and their mental health. So each year our committee reviews grant submissions and votes on funding approvals. Some examples of our funding efforts include a Rift and Activity Chair that aids pediatric patients with disabilities, teen and family support activities through the Boys and Girls Club and the Arts Program, lymphedema garments and support for cancer patients, and remodeling a portion of the labor and delivery rooms at Good Samaritan. In addition to this, WISH sponsors a variety of events to bring local women together, both for fellowship and for networking opportunities, including grant celebrations, meet and greets, and educational events focused on women health topics. We are working to increase our online presence as well, especially as COVID has had us looking at new opportunities to go virtual. So we plan to expand to online activities such as clothing and donation drives to better support our Corvallis community. A little bit more about WISH. There are 3 ways to be a part of this giving circle. One is to join or renew your annual membership, which is split into 2 different amounts based on age and is tax deductible. This allows us to get more folks engaged. That's why we have the 2 age categories, and it could be a great way to join or sponsor a membership if you wanted to for someone else. Outside of memberships, we also accept donations online in any amount. 100% of those funds go towards WISH, 90% is used in our next year's giving cycle, and 10% is stored in an endowment, which generates additional interest that's added to the funding cycle. To become a member or donate, visit samhealth.org/giving and select Good Samaritan Hospital Foundation and designate Women Investing in Samaritan Health within the donation submission. To note, there is another foundation as well, a Women's Giving Circle in Newport, and you can donate to them in a similar fashion by clicking on Pacific Communities Hospital Foundation for the Women's Giving Circle there. All donations or memberships that are received by the end of this year, December 31st, will be available for giving in the next calendar year. So we're super close to that deadline. There is a 3rd way to become engaged with WISH, and that's to submit a grant request. You can do this by going to the Foundation's department page on the SHS Insider, which is for employees. So requesters that aren't Samaritan employees can find a sponsor to submit a grant request jointly. All grant submissions are due by January 8th, 2021. So it's my pleasure to introduce Laura Hennum, the new CEO of Good Samaritan Regional Medical Center, who joined Samaritan in August of 2020, not very long ago. In the last couple of months, she's been focused on Good Sam's response to the pandemic and the recent surge, as well as a new collaboration between Oregon oncology specialists and the Regional Cancer Center to stabilize key physician recruitments that complement oncology services system-wide. And I know she's going to talk a little more about that later as well. She brings 25 years of prior leadership experience as the regional CEO of Southern Nevada, working jointly with MRS and Dignity Health to expand healthcare offerings, while splitting her time as well in Tacoma to open 3 new facilities with multi-care. Other roles include Chief Strategy Officer for Dignity Health and leadership roles across Central and Southern California. Laura is an Oregon native. She grew up in Portland and received her bachelor's degree in communications from Washington State. She also has a master's degree in health administration from Virginia Commonwealth University. It's worth mentioning, especially since this is sponsored by WISH, that when asked what brought Laura to Samaritan Health, it was in part our organization's concentration on philanthropy, seeing how our foundation responded to COVID and the Oregon wildfires in aiding the community and our employees in various ways. Laura has held key philanthropic roles for more than 15 years, having a direct relationship with other foundations as a major donor. So Laura, take it away.
All right. Well, thank you so much. Thank you, Tiffany. And it is an absolute pleasure to be here today. And thank you for everyone who has taken time out of their day to jump online and join us for this virtual presentation. I'm hopeful that I will have the opportunity to meet many of you in person when we get to a different place in this COVID-19 universe. My entire family is now in Corvallis, and my husband and I have actually been away from Oregon for 23 years, so it is an absolute gift and delight to be back. I'm also the proud mother of 18-year-old twin boys, both of whom are college freshmen, and we were able to keep one local. He's a freshman at Benton Community College, and my other son is a freshman at Southwestern Oregon Community College in Coos Bay. So very happy to have everyone in the family back in Oregon, and again living in Corvallis. So thrilled to be part of the community and really jumping in at a time when I can't think of more meaningful work than to serve the community of Corvallis, as well as all of our surrounding communities. And so that really creates, I think, the appropriate transition to talk about. Certainly want to spend the appropriate amount of time, and it's important to spend time talking about where we are with the pandemic, but also talking a little bit about other things that Good Sam has accomplished, and really taking a few minutes as well to look ahead. It's tough to see beyond the pandemic at this point in time, but it's important to not only deal with the task and the need at hand, but also to plan for other absolutely critical healthcare needs. One of the unintended, obviously, consequences or things that have occurred as a result of the pandemic is that some other healthcare needs are suppressed, restrained, and it has been encouraging to see that people are keeping themselves safe. But I always want to take the opportunity to encourage people that if you have a need beyond the pandemic, the hospital is here to serve you, and critically important to continue to take care of other healthcare needs. And I certainly know that, unfortunately, heart attacks and strokes and other urgent needs continue to emerge, and we do not want to ignore that. Even though we are testing our resources incredibly with the pandemic, we know that it is our calling to care for all healthcare needs, even in the midst of 2020, a time unlike any other. So talking about where we are with COVID-19, I thought it was critical to share that just kind of taking a snapshot in time at this point relative to Benton County, what we're seeing, not just in the hospital, but in our community. So as of this past Monday, December 7th, this is what it looked like for our community and for our county in particular. So since the beginning of the pandemic through Monday, we have seen a total count of 809 confirmed COVID-19 cases in Benton County. As we look, and this is what we do every week at the hospital, is kind of looking back at not only the prior week, but the prior 2 weeks. So Benton County is always very generous in sharing really timely and helpful information with us, that over the past 2 weeks, we had actually seen a little, I don't want to say reduction because unfortunately the cases do still grow, but slightly encouraged to see that we grew by 11 cases, and that was 11 cases per day on average, as compared to the prior week of 13 new cases per day. When we look at who has been diagnosed, so this was, comparing that 11 was comparing per day. And then for the entire 2 weeks, it was 154 for that 2 week period that ended December 7th, as compared to the prior 2 weeks, a total of 187. It's kind of a tough graph to follow at the bottom, but it just kind of gives you an idea that dark blue are those who are diagnosed ages 18 to 29. Then if you're looking at the far right, that would be for the most recent 2 week period. If you drop down to kind of that, I guess, eggplant, if you can see that particular color there where it says 28, that would have been individuals aged 50 to 69. The orange are individuals aged 30 to 49. The pink are those 70 years or better. And then that turquoise would be those individuals aged 0, so infants, to age 17. So you kind of can see from October to December 7th kind of how the cases have fluctuated relative to age as well as numbers. So these are numbers we're looking at constantly, again, just trying to anticipate where we need to be with supplies, with personnel, and just being, again, ready to serve those people who may need us, who have been diagnosed. So now looking a little bit more closely at how it breaks down in terms of what we're seeing within our hospitals. This is not only Good Sam, but also includes our hospitals in Albany, Lebanon, Newport, and Lincoln City. And I thought it was helpful and interesting. You know, we really can't have our minds kind of stretch far enough to think about kind of where we started and the fact that we're still within this pandemic. None of this is good news, but important information that we've, again, got to manage as we're looking at how best to care for our patients. So this really shows how the pandemic started when it was declared a pandemic in March of 2020, and then what it looked like in the middle of the summer, in November, where we've got the most complete month's worth of data, and then year to date. And again, this isn't the total number of cases, that's what we looked at with Benton County, but these are the cases that have actually been admitted to our hospitals in our 5 communities where we have Samaritan hospitals. So in March, you'll see that we had a significant number, unfortunately, of patients 30 to 59. Age categories are a little bit different than Benton County. And then you can see the significant percentage, more than 70% of the patients we were admitting at the beginning of the pandemic were 60 years and better. And so you can see we had no patients at that point in time at the very beginning who were very, very young, that's 0 to 19, and even young adults 20 to 29. Looking then to July, you see that changed a little bit. And interestingly enough, we saw almost an equal percentage between those patients who were admitted 30 to 59 and those patients who are beyond 60 and beyond. So very interesting as it shaped up through the summer. And then fast forward to November, again, no very, very young patients, fairly small percentage of young adults, had a decrease in that category of patients 30 to 59. And we saw, unfortunately, that number creep back up with patients 60 plus. So that very last set of bars on the far right year to date, that just now shows you how it's averaged out over the course from March through December 7th. So again, I thought it was important to share that because it shows that we continue to see incredible vulnerability with our more mature patients. And I want to continue to reinforce that we all need to be careful, and those who are more mature patients, we need to be most careful of all. So getting a little bit more into the detail related to kind of how it breaks down as far as the state, our county, and then Good Sam in particular. We do get a regular report each week from the Oregon Health Authority. So in that very top box, they shared with us their most current, that says 23/39, that actually should be the 23rd through the 29th, when they reported to us that statewide we had more than 9,000 new cases. During that week, we saw nearly 400 patients hospitalized with COVID-19, so that gave us a positivity rate of 8.6%. I will share that while we never want to see these numbers grow to this rate, Oregon has done an incredible job, and the citizens of the state managing the pandemic, being very cautious, being appropriately careful. Good Sam and Samaritan act in an abundance of caution as well. I relocated most recently from Nevada. Right now, the state of Nevada has a nearly 21% positivity rate. So again, I not only feel incredibly grateful to be here because it's not only a wonderful place to work, but it has been noteworthy the way that the state and the community has managed this pandemic. Of course, we can always do better, want to do better, but it is noteworthy that we've been able to keep it low. Of course, would like to see it at 0, and we want to continue to manage it, but it is of note that it has been growing, and we really want to get to the point where we can see that decreased. The state reports that this growth is largely attributable to community spread. So wearing the mask, which I'll touch on later, wearing your mask, staying out of large groups, staying home as much as possible, it really is a contribution to the health of our community. So now with that second box, that again now speaks to the communities in which our hospitals serve. So Benton, Lynn, and Lincoln counties. And so far, in terms of those COVID-19 positive patients we have needed to admit to our hospitals, 48% of those are male, 52% are female. So it's been interesting to see that there has been a material number higher female rather than male admitted. The average age of those patients that we've admitted who have been tested as positive is 41 years old. And we're seeing, and the good news is that we're seeing a bit of a decrease, but currently the average length of stay, the average time that those patients are staying in any of our hospitals is 7.5 days. For those cases that are confirmed, the total cases that come through our emergency rooms and then are admitted are hospitalized. That's about 6% of those who test positive who come to our emergency room or who are referred. It's 6%. We don't want any patient deaths, but our confirmed patient deaths to date has been 1% of those who have come to our hospital. Those cases that have required intensive care unit care has been 3%, and those patients who've required invasive ventilation, who have had to be intubated, is 1%. And that's really been a significant change that all of us within the hospitals have seen since the beginning of the pandemic until now, is that we've been able to decrease that use of ventilators with COVID-19 patients. That has been replaced with high flow oxygen. If you've ever seen the tubes that go in your nose, they call that the high flow nasal cannula, where it gives you oxygen directly into your nose. It's a high concentration of oxygen, which of course is far more preferable to being fully intubated, because when you experience intubation, of course, that introduces other challenges with your health and can have long-lasting effects. So it's been encouraging to see that we has, in the past few months, seen fewer of our COVID-19 patients in the ICU, and fewer have had to go on a ventilator. While we don't want to see folks in the hospital, that is a bright spot, and hopeful that that trend continues. At Good Sam, now being very specific to our hospital in Corvallis, the number of confirmed positive patients that we have admitted to our hospital, not just in the emergency room, but actually admitted for inpatient hospitalization, has been 93, and that's been since March. The number of those patients who unfortunately have passed away within our hospital has been 8. And the highest number of COVID-19 patients we've needed to admit has been 13. So those are all numbers that we don't want to keep breaking records. Again, fairly small number in comparison to many other hospitals, but something that sorry, somehow I got muted. Thinking through that very carefully. So what we have to offer in terms of hospital resources is, of course, you're probably hearing on the news every day about beds, availability of beds. For us right now, it's not so much the beds that is a challenge, it's the staff. So just like you and I, they're out in the community, they're with their families, they're at risk for community spread. So that's something that we monitor, along with potential exposures within the hospital as well. So we mask throughout the hospital, whether we're caring for patients at all. I'm actually in an enclosed office. That's the reason why I have my mask off. But when I'm out and about in the hospital, wherever I am in the hospital, I am masked as well. So we've got to do everything we can to preserve staff to continue to care for our patients. And we want them to continue to be careful, of course, to keep themselves safe. One of the things that we do with actually with any patient who's on what we refer to as isolation, we provide negative pressure. So that creates a different airflow. So you're not just continuing to recirculate air, because of course this is an airborne, what they refer to as an airborne pathogen. So we are fortunate enough that we've been able to flip a number of our patient rooms to negative, not regular, but negative pressure rooms. We also have additional filtration, which really helps clean the air and make sure that we're quickly turning over the air in a patient room. So that enables us to provide the best environment when we do have to admit a COVID-19 patient. PPE is personal protective equipment. We are in a fortunate position that currently we do not have any dangerous shortages. Of course, we are carefully utilizing our protective personal equipment. That includes masks, and we have different kinds of masks, of course, for direct patient care as well as surgery. We utilize face shields, goggles for eye protection, gowns, gloves. We also have what's called a PAPR, which you've seen the hoods that have the breathing tube, and that's actually to an individual ventilation system. And so Samaritan has more than 900 of those PAPRs, the hoods and the tubes and the ventilation system for our direct clinical staff, and we are utilizing those units throughout all 5 of our hospitals as well. And then, of course, if we do get to the point where someone is so seriously ill that they need more than high flow oxygen, high flow nasal cannulas, or those negative pressure rooms, we utilize the ventilators and the BiPAPs. So those are really, the tools that we're. And the other really special part of Good Sam as a teaching hospital is, in addition to our staff and all of those resources, we also have a number of COVID-19 related clinical trials that we currently have active. So I just wanted to provide a little bit of the detail for those 4 key studies that we either have in development very close to launching, as well as the active studies. Dr. Adam Brady, who's involved with the first study I've listed here, he's actually our head of infectious diseases, and he has been instrumental in the way that we've been able to manage the pandemic throughout Samaritan. But you can see the number of patients that we have enrolled in that first study. You can see the second study is much smaller, but we're still actively enrolling patients and screening them if they would be eligible for the cytidine COVID-19 treatment. The third one is in development. I'm hopeful we'll be rolling that out very soon. And then the fourth is a study that's linked with the Mayo Clinic. Dr. Brian Delmonico is involved with all 3 of those studies, and we currently have 50 patients enrolled in that study. Dr. Delmonico is one of our intensivists, and so it is incredible to see him involved with these 3 studies, and obviously with his direct patient care in the intensive care unit, it is near and dear to him to find other ways that we can care for our patients who we find are positive with COVID-19. Please, please, please continue to wear your masks. They really do make a difference, and I'm here to reinforce. These are four photos of 4 of our Samaritan employees who recognize the importance of wearing a mask. So just want to continue to spread that word and reinforce the importance, and that does make a difference. Research supports that it makes a difference, and it is an easy thing. No, it's a hassle. It's an easy thing for us to do. So let's talk about the vaccine for a moment. So thinking back on what all of us are seeing, hearing about the vaccine, we are very close. The state continues to share with us that we're looking at delivery of our first doses of vaccine this month. So we are hopeful we will be seeing, it probably will be a limited amount of the vaccine, but looking to receive that later this month, so later in December. So right now, what the federal government has identified, and of course the state is leading us through, would be 3 phases of a vaccination program. So with phase 1, unfortunately, the supply is fairly limited, and the focus will be on vaccinating healthcare providers. So those who provide direct patient clinical care and who oftentimes can be the most vulnerable in terms of their ongoing direct and indirect exposure to patients. It also will focus on long-term care providers, so those who work in long-term care facilities, nursing homes, who also have, I don't want to say constant, but regular direct and indirect patient care exposure. Depending on the amount of vaccine, we may be able to get to the point where we can provide some vaccination to high-risk individuals who would be those who are 65 years or older, and those who may be at severe risk of contracting the disease. But it really depends on what we may see in terms of that initial delivery. Then as you move to that middle column, phase 2, the intent is there would be a larger number of doses available, and that's where we could have a broader vaccination beyond just the frontline healthcare workers and really move into a broader vaccination of those folks who are at risk, and potentially even get into the broader general population. And then ultimately that far right column, which is phase 3, where we have a sufficient supply of the doses, much broader distribution, where those who want the vaccine would be able to get it at that point. So waiting to hear more in terms of delivery for one dose, for those phase 1 doses. So this just gives you a quick rundown of what the state has communicated to us. I've already touched on our hope that we will be seeing the initial delivery later this month. I think the second point is important and interesting because we've been hearing a lot about Pfizer, we've been hearing about Moderna. There is also the AstraZeneca Oxford vaccine that looks like it may be fairly close. But right now, Pfizer and Moderna are the two that we're expected to receive early on, with Pfizer first. Pfizer is the vaccine that must be kept at ultra cold temperatures. Good Sam has an ultra cold freezer in place, and that is ready to receive the vaccine and be able to store it at below 80 degrees Celsius. So it is incredible, the resource that will be needed to preserve the Pfizer vaccine. The Moderna vaccine does not have the same temperature storage requirements, so we would be able to store it in what's kind of our typical pharmacy freezers. So we have adequate storage for the Moderna. We also have adequate storage now with the new ultra cold freezer for the Pfizer as well. What's been explained to us by Dr. Joe Sullivan from the Oregon Health Authority is that, interestingly enough, these vaccines are fairly fragile. The vaccine also doesn't contain any live or dormant virus. It's what's referred to as an mRNA vaccine. It is very, very different. Of course, I think we're all going to be learning more as individuals are vaccinated, and they will not be available. None of the vaccines, no matter the maker, will be available until it's received the emergency use authorization from the FDA. And as I mentioned, probably anticipating that greater amount of vaccine to be available for the general public later in 2021. So jumping to kind of beyond COVID-19, I have been really excited to be part of the team that has accomplished, in the midst of the pandemic, accomplished so much at Good Sam. Good Samaritan Regional Medical Center continues to be what the Centers for Medicare and Medicaid Services refers to as a 4-star facility. So very happy that we've been able to preserve that rating. And that just really shows that we're stacking up in terms of our experience, our patient experience, the services that we provide, and the pricing for our services. Actually, there is one more thing I do need to touch on that we can, one more silver lining, if there are any, silver lining related to the pandemic, is that we have been able to expand our e-visit capabilities. So as we've had to have folks at home, as people have needed more access, not less, but also in an effort to keep people safe and help them remain at home, we've been able to expand our e-visit capabilities. We had e-visit capabilities early on, but we recently expanded them earlier this month for a number of our selected Samaritan clinics, as well as for Samaritan Cardiology. You can go on to the samhealth.com website, go to telehealth, and you'll get more information. But the bottom line is that if you are seeing a Samaritan physician and currently you're one of the clinics that's utilizing e-visits, you will be able to schedule an e-visit appointment, and it gives you 24/7 access to a provider if you have a concern, if you have a question, if you need follow-up, and it really is a tremendous resource. We are looking to planning to expand those e-visits to additional Samaritan clinics in 2021 and beyond. So digital healthcare is here. Another accolade that we were able to garner in 2020 was the Outstanding Patient Experience Award. And actually, one of our sister hospitals, Samaritan Albany, had also won this award, and we're 2 of only 9 hospitals throughout the state who received this recognition, and it actually places us in the top 15% of hospitals nationwide for patient experience. So I didn't want to miss sharing that, and really a result of the hard work of the frontline healthcare workers here. We also were able to make a significant investment in enhancing our robotic assisted surgery. And I'll share with you that I had the opportunity to actually scrub in, mask up, the whole thing on this past Monday, and I was able to observe, with the patient's permission, observe one of the robotic assisted procedures in our operating room here at Good Sam. And it really is amazing. I had the opportunity in one of my previous positions, the hospital I worked for many, many years ago, I made one of the very first investments with robotic assisted surgery. I will tell you the difference between then, 20 years ago, and now. It's amazing how far robotic surgery has come, just in terms of shorter recovery time, less bleeding, and now in terms of the upgrade in the technology and what we now have available at Good Sam, the improved 3D views, and really a greater range of motion for the surgeons. And what was always fascinating to me is that with the robotic surgery, it removes any shake, any tremor of the surgeons. And we know surgeons are precise, but it makes them even more precise. So I really wanted to take the opportunity to share this too, because it was invigorating to see that and know that we're able to offer that to our patients. Touch quickly on what we're doing with our stroke program. We have had a stroke center, a stroke program at Good Sam since 2007. It has been certified as a primary stroke center by the American Heart Association and the American Stroke Association. And we just got recertified, just got the certificate this morning, so it's hot off the presses, that we were recertified by DNV, and not people, when I say DMV, they think DMV, so it's not Department of Motor Vehicles, but DNV is an accrediting body that accredits hospitals worldwide. It's accredited 500 hospitals throughout the country, and DNV has accredited our primary stroke program as certified by their worldwide organization, that we meet the highest standards of safety and patient-centered care. So really pleased to sing the praises of our stroke program and the recent recertification. I would be remiss if I did not point out the incredible response, and really need to laud the entire community for the response to the wildfires. I had been on the job for all of 1 week when the wildfires broke out, and to be able to count on people in the community and individuals throughout Samaritan to respond. For those of you who may not be familiar, Samaritan has a brand new, beautiful hospital in Lincoln City, our North Lincoln Hospital, and it was threatened within just a few miles across the lake from the hospital, threatened by fire. We really were very afraid that we were going to lose the hospital, and certainly and unfortunately there were a number of employees who lost their homes during the wildfire, like many members of our community. And so we've been able to band together. Not only were we able to quickly evacuate the hospital, we were also very able to quickly come back to the hospital when it was safe, reopen the emergency room, reopen vital services, and we continue to support those hospital employees who lost their home through programs available through the foundation and employee giving. And so really proud to say that we, like so many other organizations, have been able to come together and help people when they really need it. And it did create another incredible challenge in terms of caring for people who needed care when it was difficult to get access. So we were able to evacuate all of those patients at North Lincoln to Newport and continue to care for them, continue to deliver babies. So terrible time and a wonderful time, all at the same time. Those of you on the phone may not be entirely familiar with what we're doing with Stanford. We have actually, for a few years, we have had a very innovative heart program partnership in place, and we're going to be talking a whole bunch more about it in 2021. The pandemic, of course, has directed our attention elsewhere, but we're really eager to get to a new place where we can talk about the incredible Samaritan Stanford partnership. What this partnership, what this collaboration enables us to do is to bring advanced cardiac care to our community. We have two Stanford faculty members here, Dr. Garra and Dr. Bender, who provide these advanced surgical procedures, including the transcatheter aortic valve replacement, which oftentimes is referred to as TAVR. And so we provide all of those procedures at Good Samaritan. At the same time, while Dr. Bender and Dr. Garra are caring for patients here, they also can consult with world-renowned specialists at Stanford. If there is an unusual case, if there anything that makes a case particularly complicated, they can interact with the Stanford faculty who are actually in Palo Alto, and again enables us to keep their care and their follow-up kind of pre-hospitalization, while they're hospitalized, and post-hospitalization, all keeping them in the community, but being able to access the incredible brain trust that we have available to us at Stanford. So really excited about what we have available through this innovative heart program, and excited about talking about this on a much broader basis going into 2021. And Samaritan, lucky number 7, for the 7th time, we were recognized as Oregon's healthiest large employer. So it is noteworthy. Hospital employees, it's amazing. Sometimes we forsake our healthcare. So it is with much gratitude that I say that Samaritan finds every opportunity to encourage wellness, to provide resources, and it just makes for better community members as well. This 2020 marks a very special year in terms of equity and inclusion for Samaritan. 2020 is the first year or year 1 of a 4-year plan with our equity and inclusion plan, also available on our website. So if you go to samhealth.com/equity, you'll be able to see our full inclusion and equity plan. This is a photo of our Equity Inclusion Council. So very thoughtful individuals from throughout all 5 of our facilities, as well as system level leadership, who've really committed themselves to ensure that our healthcare is equitable, not only hiring practices, but the care that we provide, that we really are providing people with the care that they not only need, but also in a way that they're looking to receive it. So this is something that we'll continue to recommit ourselves to, and really looking forward to year 2 of that 4-year plan going into 2021. In addition to the equity and inclusion plan, something that Good Samaritan and Samaritan have been doing for a very long time is community outreach, meeting community health needs. And so at Good Sam in particular, we established the social accountability budget and program back in 1996, really to move us forward on these 6 key goals. These are really our guiding principles that we're looking to improve the health of families, kids, teens, and seniors, at the same time creating that greater access and better networks. And by better networks, that means that we just continue to find different ways for additional physicians, specialists who can who can join, be part of our network of providers and our network of care. And along with moving those 6 key goals forward, every year we also provide significant grant funding to community-based organizations. So this is a list of all of the organizations throughout Benton County that we supported with grant funding in 2021. And I'm excited to share with you that next week we will be announcing the community-based organizations who we will be funding in 2021. So what's ahead? So that's everything that happened in 2020. Very proud of that. What's ahead? So in 2021, just like any year, we always have our work guided by our mission, vision, and values. And sometimes if you know folks who work at Good Samaritan, they talk about pride. So pride stands for passion, respect, integrity, dedication, and excellence. So pride is really what guides our work and guides our goal setting and what we're about. The other thing that guides us are really 4 pillars or 4 key areas of our strategic priorities. So I was just talking about community health and social accountability. That's a key part of that right-hand side, which is the community partnership. Below that, bottom center is the sustainability. So how do we deploy our resources in the best way possible? How do we make sure that we're optimizing and at times conserving our resources so that they can be utilized to their highest and best use? On the left-hand side is employee engagement. So just like the healthiest employer, how are we communicating? How are we supporting our employees in a way that they're engaged, not only with the organization, but fully engaged with patient care, because that's all we do. That's all we do is patient care. So we want to make sure that they're engaged in every way so that they're aligned not only with our mission, vision, values, but what are our priorities for that patient care. And then last but not least would be that top center, the quality and service excellence. And there'll be a couple of things I'll touch on relative to quality and service excellence. And this is really it. Our pride in safety together is what we refer to as our statement of safety. So in terms of what's ahead in 2021 is that we have committed ourselves to being what's referred to as a high reliability organization. So you cannot be in a safer place than within Good Sam in any Samaritan facility, any Samaritan organization. And so pride and safety together, we are putting safety at the top. Safety is the thing that will drive us in addition to those pride values. And so that's what we're looking ahead to. And then I just wanted to touch on a few things that we've started in earnest on in 2020, but man, they are set to grow. So just like we're tending to our garden, these are the things that are budding, and we look forward to blossoming in different ways in 2021. The first is something that the foundation has also been supporting, and that's certification of our mother and baby unit, our women and family services as baby friendly. And baby friendly is an designation that came from the World Health Organization and UNICEF, and it's really a very focused effort to promote healthy eating, healthy feeding choices for infants. So obviously a lot of focus on breastfeeding. So we've gone through over many months, gone through a very intensive education and training with our entire OB staff, obstetric staff, women and family center team. And now we've completed the first half of a 2-part independent survey. The first part was surveyors at the very beginning of this month, surveyors interviewing, kind of further testing our staff to make sure that this is fully ingrained within our organization. The second part is what we're expecting in 2021, which will be baby friendly, and those independent surveyors interviewing our OB patients to make sure that we have made all of this great education and training actionable, that our patients are actually seeing it and experiencing it. I also wanted to talk about what we're doing with our Pastega Regional Cancer Center and the Samaritan Oncology Services. We have entered into a really unique collaboration with Oregon Oncology Specialists, which is a very well-regarded, long-standing physician group with multiple medical oncologists and number of programs for oncology specialists. They are bringing their expertise to us in Corvallis and throughout the Samaritan system, and they have started. So again, started in 2020, but really bringing into full bloom in 2021, recruiting 4 to 6 medical oncologists, hematologists, oncologists for our oncology services and for the cancer center. And I said 4 to 5 here, but it's actually 4 to 6 advanced practice practitioners. That would include nurse practitioners, physician's assistants who are experienced and well-versed with oncology services. So this will be an incredible lift. All of these new permanent providers who are being recruited specifically for Samaritan. And the goal is to not only have them available for patient treatment, but really make them part of the fabric of our community and part of the fabric of the Regional Cancer Center. And after lots and lots of planning and great fundraising, so again, kudos to the foundation, we will be starting on the Mario Pastega house expansion. We will be adding 7,500 square feet to our Pastega house. You'll begin to see some of the work related to that in 2021. The goal is to have it largely completed by the end of 21. But we've just had incredible demand, and the Pastega House, for those of you who may not be familiar, is a place where families can come who are coming from out of town, from far-flung areas from elsewhere in the state or elsewhere in the country. It's really a wonderful way to support these loved ones while they have a patient who's being cared for at Good Sam. And then last but not least, you may have heard that actually back in 2002, Samaritan Good Sam had purchased 84 acres that were part of the Owens Farm. We are now just, you won't see construction in 2021, but we will actually start what's called programming. So deciding what we may put on the property, just a piece of those, not all 84 acres, but we've taken a piece of it, annexed it with the city. We're very grateful for the city to annex that, and finding out how we can identify much needed space for additional services associated with Good Sam. And so I just want to wish everyone, thank you for your attention throughout this presentation. And again, keep those masks on, keep the social distancing. We want to keep you healthy. As much as I would love to see you at Good Sam, I don't want to see you as a patient. I want to see you in the future for community events and other presentations like this when we can do it in person. So I wish you a very, very happy and healthy holiday season. So I think we're ready for questions.
Thank you, Laura, for an excellent presentation. I wanted to ask you the first question that came in prior to the presentation, which is, do you know if there are any risks with COVID vaccinations for over 60-year-old cancer survivors during radiation or other treatments?
It's a great question. And what I would encourage anyone who is undergoing active treatment of any kind, and certainly with active treatment for radiation oncology, I would encourage you to talk directly with your provider. In the case of radiation oncology, I would encourage you to have a detailed discussion with your radiation oncologist. It's so early with the vaccine, and it also is dependent on an individual's response if they've had any issues. Obviously, this, like I said, this is an mRNA vaccine, so it's different from, let's say, a flu shot. So I think just makes it more important than ever to talk with your personal physician. Any questions that you may have. I think it's going to be a great thing to be able to access, but for someone in active treatment, taking any additional prescription or accepting a vaccine is something that would need to be discussed carefully with your provider.
Great,
but thank you for the question.
We have a couple questions from Dave. The first one, maybe if you don't know, my colleague in Lincoln County will know. The open house for the new North Lincoln Hospital was canceled due to COVID. Will it be rescheduled at some point in the future?
That's a Yeah, I hope so. And I would be happy to take that question forward to the North Lincoln team. So I would like to think that it may not be an open house per se, but a community-based event. So I will make a note. Dr. Leslie Ogden is the CEO there, and I will be happy to take that forward to Dr. Ogden and let her know that that would be a wonderful thing to do.
Great. And then I know that you and I have been talking about this. So the other question is, what is the status of the ODOT work to build the new intersection to replace Highway 99 and Elks Drive?
Yes, very good. We have approved all of the money, all of the budgeted funds that are needed to start on that intersection. So for those of you who may not be familiar, it's Elks, 9th and 99 that we will be improving, moving the main entrance, and that's actually a key part of the North Campus development. I know the first step will be the relocation of what's referred to as franchise utilities, which, you know, probably won't be, it won't make too much of a difference initially in terms of how that intersection is organized, but it's something that has to be done before we can change the intersection. So that will be really the focus for 21 will be the relocation of those utilities. Then we will be able to see a lot more work related to reconfiguration of the intersection. And as I say, you won't need that third eye to be able to turn left from 9th onto Elks. So you will see work beginning in earnest on that intersection in 21.
Great, thank you. And then I know Gloria, she's on the line. Gloria, you have your hand up. Do you want to ask your question?
I have not heard anything mentioned about a woman who's breastfeeding, whether it's safe for her to have the vaccine.
So thank you, Gloria. So another really, really good question. If anyone is a mother who is breastfeeding, again, that would be a key question for your OBGYN to have that discussion relative to the vaccine. I would love to say that I know everything about the vaccine, but this is one of those that I know that we've had presentations with Dr. Adam Brady, who's our head of infectious diseases. I am almost quite sure that he would probably be saying the same thing if he were sitting here. This is a discussion that an individual, including a breastfeeding mother, would need to have with her either OBGYN or family physician about what would be the pros and cons associated with the vaccine. The good news is that because we've got a little bit of, I guess, good news, bad news, we've got a little bit of time before there'll be that broader distribution of the vaccine, so there will be time to have those discussions. So, and you know, Gloria, I'm glad that you brought up the question, because the other thing I should have mentioned, and this is very important, is that right now both the Pfizer and the Moderna vaccines are they're 2-dose vaccines that will need to be given between 21 and 28 days after the first dose. So it is a commitment, you know, in terms of getting the first as well as the second dose. So these are going to be really, really important discussions that many of us, depending on what our health history is, or if we're an active patient now, we need to have with our providers, just to make sure we have the peace of mind and we have all the information we can get from experts before we make the decision of receiving the vaccine. So thank you for your question, Gloria.
In the chat session, you can see Jennifer had posted next week's talk with Dr. Brady for the public on the vaccine. So there might be an opportunity there to ask that question. Maybe we'll give him a heads up on that, some of the ones we received today, just to see if he can address it.
Daryl, actually, I think that's a great idea. And for those of you who do have questions, Dr. Brady is exceptional and thoughtful. And if you have the time, I'd really encourage you to take part in that session with him. He is a wonderful resource for us in this community, so that's great.
I have a question.
Okay.
Okay, so I know it's only been 4 months or so, but you've been around, you've worked with some other great institutions. In your time here so far, what insights have you gleaned about the hospital and Samaritan Health Services?
That's a really good question. So, I will admit to everyone on the call that I started my career with Providence. I've been in healthcare for more than 30 years, and for better or worse, I've worked with a number of health systems. And what has absolutely struck me about Samaritan and Good Sam from the very beginning is how much the organization does care, not only for its patients, but for its employees. So when we talk about, healthiest large employer, I think it's important to say that, it's not a gimmick. It's not, just something that happens, to help with advertising. It is real. Yeah. And I feel very fortunate that I get to share in information that's provided to our team about wellness, about mindfulness, and sometimes that it can sometimes feel, I always say sometimes it feels a little new agey, but in the midst of a pandemic, in the midst of being a healthcare professional, it really gives that additional facet that we need. That we need to take a moment. And again, even if you're not in healthcare, I think we're all experiencing pressure like we've never experienced before. And so for a healthcare organization to recognize that, to recognize, 7 years in a row, to consistently recognize that is very much needed. Right now, our biggest challenge is having adequate staffing. And again, we're lucky that we've been able to keep adequate staffing for all of our services. And so that's why I say, if you have a healthcare need, please pursue care. But, as we think about, will there be another surge at the end of December, after the beginning of the year, keeping those employees well, keeping each other well, and a health organization that is willing to make that investment to not only treat folks, but to keep each other well it is significant. It is very special. The other thing I will add is that to have a hospital of this size that not only is a level 2 trauma center, has a distinguished heart program, but to be a teaching hospital as well has been noteworthy for me. So I would say in my first 90 days, those have definitely been the things that have struck me, and that it's just so ingrained in the community. It is a tremendous resource, and I hope that people will continue to take it. And since a couple of people posted it, I can't not let it go by. Go Cougs. So I love that there are some fellow Cougs. So indulging me as a Washington State University grad, and go Beavs. I think, another land grant university. I like the Beavs. I love the Beavs too.
Good.
Thank you everyone for your time today. This has been a pleasure for sure. Being able to host this from a WISH perspective and just to listen to Laura's speech today. Please, if you have more questions about WISH or interested in some of our upcoming events, visit our samhealth.org website. You can find more on all of our foundations as well as other areas of our hospital and organization as well. Thank you everyone for your time.
Thank you everyone. Bye-bye.
Bye.